Hi, my name is Mick Rogers from Axial Benefits, and today we're going to continue the series that we started about 10 weeks ago. You know, during the early days of the quarantine, we heard from so many of you with your questions, your thoughts, even some of the anxieties. So we thought that we'd put together, a video series of, a hand-selected small group of experts that could answer a lot of the questions that we got in their specific field, and we'd put it on a video format so that it would be easy to sort of understand and easy to watch. Today, I'm really excited about my next guest, Jeff Greenberg. Jeff is one of the founders of a company by the name of FireFly Health. But what I'm really excited about is because, just in the fact that we're talking to Jeff about his COVID reentry support program signals to me that we see the end, of coming out of this quarantine, right? That this pandemic is somehow going to be controllable and we'll be able to move forward. So the question that we have, as business leaders is we're all trying to think about how are we going to transition our employees now who have become comfortable working, on a remote or home location back into the office environment in a safe way. So welcome, Jeff.
Thanks for having me. Excited to be here, Mick.
Great. So, Jeff, in the early days of the quarantine, we had to interview, attorneys, and they had to go through the difference between a furlough and a layoff. And then there was HR consultants about, communicating to your remote staffs and the issues that may come up, of communication that way. Then we talked to a lot of benefit experts about, protecting their benefit programs, even 401k experts to talk about the impact of the CARES Act and what that might have on the fiduciaries. And now that we've become experts in all things, remote, we have to sort of switch gears now, and we have to forget about all that and really think about how are we going to, in a safe, carefully thought, professional manner, how are we going to get these employees back to our work environment and make them feel comfortable? And I know that FireFly Health has developed an employer program that I think is the most innovative thing that I've heard out there right now in this type of back to work support program. And while I want to dig deeper into that in a minute, I know that that's not your core business. So can we start with can you give us a brief overview of what FireFly Health does? What's your overall business model?
Sure. Thanks again for having me. FireFly Health is a virtual primary care company. My founders and I are former primary care physicians and leaders in traditional practices, and we started FireFly about 2 years ago to develop a much better model. So we replace people's traditional primary care, or in many cases, offer people primary care that they don't currently have. And our model is one that focuses on convenience, but also continuous support for behavior change, for chronic disease management, along with acute issues and wellness. So we are a very technology-enabled company. We have both clinicians on our team and engineers, and we built a technology platform that enables our service to be virtual. And what that means is not just video visits, that's part of it, but people download our proprietary mobile application. They can text message in a HIPAA compliant way with their care team. They can develop care plans personalized to them with their care team. And we take care of them over time. So as many, new age primary care companies, I won't name any, many will do sort of episodic visits, and you have a different doctor every time. And many employers use these as benefits. If you're sick, you can dial up a doctor. What we offer is a continuous experience. You get a care team that knows you, that replaces your primary care, that follows up with you about everything from keeping you healthy to getting past acute illnesses to managing chronic disease. We also do a lot of behavioral health. Every care team has a behavioral health specialist and a behavioral health team able to help folks with depression, anxiety, ADHD, which are so common. We also take insurance. So we are not a concierge model in that we work with commercial insurances. And we are in network with most commercial insurances in Massachusetts and spreading to other states.
That's great. You know, and we're big fans, right? I mean, we think that this type of primary care, you know, high touch, sort of non-episodic primary care can really, you know, drive costs down in the long term. And you know, we're really excited about what you guys are doing. But this is really interesting though, because you've developed a COVID reentry support program for employers. You know, and it helps, I think, employers develop an overall strategic plan of how to get sort of folks back into the environment. Can you tell us a little bit about that?
Yeah,
I
sure.
love the fact that you're just like everyone else and dealing with children in the background. So this is
Exactly.
awesome.
Yeah. It's normal, right? This is how we roll. Yeah, so we work with a lot of employers and to provide our full service primary care. And what we realized is so many employers are dealing with exactly the problem you highlighted, Mick, of how to get back to work and how to do it safely in a reliable way that people will trust and should trust. So our program is kind of a lightweight version of the full FireFly program, leveraging some of the best aspects of our model, notably our technology and our convenience. So what the model involves is a special version of our mobile application. And once employers sign up, we screen their employees. They download our app and we screen them for folks who either might have COVID right now, because you don't want someone to come back to the office if they actually might have COVID now, or folks who might be particularly high risk to get sick if they got COVID, because maybe those are folks that shouldn't be in the first wave to come back or have special arrangements, right? If they have multiple chronic disease, or if they're getting over cancer or some condition that might compromise their immune system. So everyone gets an initial screening right in our app. And at that point, if someone tests positive or screens positive for likely COVID, we can get them tested. So we have partnered with testing facilities, at-home testing facilities, or at-work testing facilities to get folks tested if they need it. Anyone who screens positive and tests positive and appears to have COVID, we'll offer short-term treatment for them. So we'll take care of their condition and get them through COVID, right? So that involves following up with them on the application, doing video visits, checking in with them. You know, it's easy for us to follow up with patients. We can send messages and say, how are you doing? If they're not getting better, jump on a video visit. So that's what happens if someone looks like they have COVID. And then when folks go back to work, we do a daily symptom checking. So it's super important that we don't let people come to work if they might have been exposed to COVID. So what that means is every day people get a questionnaire when they wake up in their application, and it's just 3 questions. Are you having symptoms of COVID? Do you have a fever? And is anyone around you symptomatic in a way that makes you potentially exposed to COVID? And if folks say no, boom, they go to work that day. If they screen positive, then we do a video visit with them very quickly. And we help assess their risk and get them tested and so in that way, this is combined with all the other things the CDC recommends. So, you know, making sure that we're doing appropriate social distancing and wearing masks at work, and have all the sort of guidelines of where people should be. This allows folks to return to work knowing that everyone who comes back has been screened and is being as careful as they can be.
Yeah, I think, you know, so truth be told is we're accessing this service for Axial employees here. And I know that when we announced it, you know, first of all, we were struggling with how were we going to do it. I mean, we had crazy thoughts about, you know, everything from everyone's temping, you know, before they come into the office, to us actually taking their temperature and asking the questions. And, you know, when I was talking to you about this, it really just clicked that this could be, you know, the answer to plug into you know, your bigger plan, to put that professional aspect and let the decision making be done from the professionals, right? If someone's not really safe to come to work, we're going to let a physician tell them that, or a nurse practitioner tell them that.
And then make sure they get the treatment that they need, right? So to continue, if you're sick, we can help you get treated. Another thing to note is we also do screening for behavioral health conditions, which are so common nowadays. We're seeing a lot of anxiety, a lot of depression flare up, as you can imagine. And these are things that oftentimes people don't know about or are afraid to bring up.
Right.
So by screening for those things, we can identify them and help patients get the help that they need to
Right.
make
Even
them
so,
healthier and more productive at work.
yeah. Right. Even some of the new anxieties that they might have about coming to work, right? Having you
Absolutely.
involved and having someone access to, to do it. I think it's just a really, really, really nice touch to a bigger pie. So, um, talk a little bit about the employer interaction, right? I mean, every day we get a
Yeah,
dashboard.
absolutely. So with patients, with employees' consent as part of this program, we can share the results of the screening. So if someone's screened positive, we can let the employers know who's screened positive in terms of symptoms. Are people positive on the test? Are they negative? When can they come back to work? Sort of what state are they in? And then, so we can help employers understand the state of their workforce, where people are in the program, where they are sort of in the pathway, if you will,
Yeah.
from something popping up that they might have been exposed to, potentially being sick, to recovery, to getting back to work.
Right. And I'll tell you, the onboarding questionnaire process was very thought-provoking, right? So it got us thinking about things that maybe we weren't necessarily thinking about, like, do you have a quarantine room? What happens if someone, someone is, shows symptoms at work, right? What are you going to do? We're going to put them in a quarantine room. We're going to put them on with a visit with, with a FireFly Health physician right away, right? So those are great. So there's also so this is sort of the initial stage, right? What on an ongoing monitoring, what happens if if there's some type of cure or immunization for this going forward?
That's a great question. I mean, there are many things that we're monitoring very closely, and that's one of the advantages you get when you work with us, is we are, keeping up with all the guidelines that almost seem to change by the day in terms of testing, in terms of treatments. So a couple things that could develop that would be game changing. One is if these antibody tests, the serologic tests, the blood tests, right now you can get these tests, but we don't know what it means, right? If you test positive for the antibody, does that mean you're immune? We don't know. So more developments there could certainly impact the back to work program. You may have some people that turn out are immune and can just go back to work and can be treated differently. Certainly there's two kinds of treatment, of medications that could come out. One is treatment for people who have COVID, and that would be something we could obviously use as part of our visits with patients and our treatment program for people who test positive. The other medication that could, become available is could there be a medication you would take prophylactically to prevent getting COVID if you're exposed? We call that, we call that prophylaxis, right, or pre-exposure prophylaxis. So in that setting, it seems unlikely that everyone in a workforce would take such a medication. It could be that those who are exposed would. Right. And that highlights the real importance of contact tracing. So it's a really important part of what employers need to know as they bring people back to work is they need to keep their distance, they need to wear masks, but you also need a way of knowing who they're around, right? So segregating them in a way so that if Jane at the end of the hall tests positive, who's Jane around? Hopefully not everyone in the building, but the 10 people that Jane interacts with. And those are the people that we could then screen for symptoms. And if there were a medication to help prevent COVID, you could think about taking that. If there's a vaccine, hallelujah, we would all be so excited. I think we're still some months away from that. But were a vaccine to come out, a whole lot of things will need to happen in terms of the distribution channel for that and the production of those. But certainly FireFly and others can help make sure that people get the vaccine, and that if there's not enough vaccine at first for everyone, who are the highest risk people who should get it first, right? It may be those folks who are older, a little sicker, have some condition that compromises their immune system. They might be the ones to get it first, and we can certainly help with that.
That's great. So guess sort of last question before we wrap it up, but and this is really, I think, because I know you guys and I know sort of what the type of quality environment that you guys have created and sort of foster. What if an employer is using you for this reentry support, and one of their employees really liked sort of, the model and wanted to sort of continue on their own with FireFly Health, is there accommodations so that they can become the primary care physician? How does that work?
Yeah, absolutely. And look, to be perfectly frank, we hope that happens because we think
Yeah,
people love the service, become more and more comfortable with
I do
virtual
too.
care.
I do too, by the way.
Um,
Yeah.
and we hope that happens, and we think we deliver great care. So absolutely, if employees during this process realize they don't have a primary care physician or do but want to switch to us, that is absolutely something they'll be able to do. And with that, they'll be able to do full visits with us for conditions beyond COVID and for regular health assessments. They'll be able to access our behavioral health team if they need it. They'll be able to access our health guides and coaches who have can support them in weight loss and nutrition and things like sleep. So they can absolutely at any point switch into the full model. As I said, we're covered by most insurance companies in Massachusetts and spreading into New Hampshire and other states soon. So we'd be excited about that, and we hope some will.
That's great. So do I. So thanks again, Jeff. And as always, we'll make sure that we include Jeff's contact at the end of the video clip for everyone. And so lastly, as we sort of sign off here, we've all worked so hard, during this quarantine, and we don't really want to let the gains that we've made go. So, please, continue to stay safe. Keep an eye out for other regular updates, sort of from us in this series. And thank you very much for your time.